Let me start with the first one for Dr. Sondick. Dr. Sondick, could you comment on objectives related to cancer survival? You didn't present data on that, I'm sure, because of interest of time, but do you want to just make some comments on cancer survival?
Yes, cancer survival has been rising, although slowly, but it's complicated by the fact that it's overall cancer. So for some cancers like breast and colorectal, cancer survival has clearly been increasing over time as the mortality has been declining. But there are other cancers that are increasing. For example, pancreatic cancer, which has very low survival. So when we put the mix together, we see a relatively small change. We're waiting for an update on our data to actually add a figure for that. But I think in survival, and I think my NCI colleagues would agree with me, it's important to look at the individual cancers as opposed to looking at the figure overall, as well as looking at that figure overall.
Yeah. In terms of the developmental goal of mental and physical quality of life, just last year we launched a new data linkage between the SEER registries and CMS's Medicare Health Outcomes Survey. So this is a linked data set that allows analysis of pre- and post-diagnosis quality of life at a national level the first time. But this is still in a kind of an exploratory area, and we now have both internal and external investigators analyzing those data. But if you're interested, you can Google that or look on the NCI website for the SEER MHOS data set.
Thanks. That was Dr. Coyle commenting. Thank you very much. Next question goes to Ms. Cox in Oregon. Can you comment more about insurance coverage for genetic testing and genetic counseling? I know you have a lot of insurance plans at the table working with you. This questioner says that his or her experience has been that often insurance does not cover genetic testing and genetic counseling.
Yeah, that's an experience that many of our providers find as well. And there's great fluctuation in Oregon as well as in other states between policies and between providers. Both Michigan and here in Oregon, we're working to get some consistency and have the insurance companies follow those evidence-based guidelines. But for those who don't have that work being done in their state right now, there is one option for underinsured people who qualify for testing, and that's a group called Cancer OneSource. And they will subsidize for the underinsured who qualify for testing some of their copay or other amounts, and that's available nationally. So Cancer OneSource. And Myriad also offers for the uninsured testing at reduced cost or free, and the paperwork is perhaps arduous, but well worth it for those who qualify.
Okay, Dr. Corey wants to add more on this one.
I think Summer is right, and there is large-scale fluctuation from states to states about coverage. Just one piece of information that the consistency with the USPSTF recommendation on BRCA1, that's the G1 goal, would require coverage of genetic counseling of women with certain types of family history, but does not necessarily extend to the testing. So it's the first step in a process, and after the counseling, there is may or may not be testing.
Okay, Dr. Clancy is going to comment too. This is a good question.
Just to chime in on this a little bit, the current recommendation on the books for BRCA1 and 2 was published, I believe, in 05 or 06. So that predates the Affordable Care Act. In which case the task force was focusing on science, and people could debate the science and so forth, but whether or not the test was covered they could be implicit and not as specific and concrete as now that their recommendations are directly linked to ACA provisions is. That was very important feedback that we've gotten from a variety of groups, and in particular, I think, confirmed the wisdom of the task force of engaging stakeholders very early in the process. So I can't possibly tell you, I was going to say I'd have to shoot you, but that isn't it. I actually haven't seen the draft recommendation, and I do believe that they are still working on it as we speak, but I can tell you that this issue is at the forefront of their brains.